Okay, so just looking at our agenda this morning, welcome to everybody, and then we'd like to give you a little information about these meetings, and then really we've traditionally used the September meeting for a checking in with everyone about how you're doing, what's going on in your organizations, what are the new challenges, but also the great new things that you're looking at. So we'll have some time for that, and then moving into ideas for our future partner meetings over the next year. So think about some of those, share a few resources and FYIs, and just a reminder that our next meeting is on October 24th, which is a Tuesday. With that, so we were just thinking maybe today with our number of folks that are able to join, that we might actually do get people to introduce themselves online and give a little bit of an idea of where you're from and who you're with, that kind of thing. So I can start with, I'm Helen Lightfoot, and I'm with the Connecting People and Community for Living Well team there. So I'll just go down my row here. Actually, I'm just going to open there. There we go. So the first person I have here is, sorry, it's hard to see the names. I've got Renata Mikalski. Renata, we can't hear you if you're on mute there.
Morning, everybody. Yes, I'm here.
And where are you from, Renata?
From Alberta Center, I'm an executive director here.
Sorry, I couldn't actually hear that very well, but maybe somebody else.
I see in the chat, Renata's from the Ogden 50+ Activity Center in Calgary.
Oh, okay, great, thank you there. And then I have Krista Mulberry next in my list.
Good morning, everyone. I'm Krista Mulberry, Social Prescribing Project Manager with the Edmonton Seniors Coordinating Council.
Great, thank you, Krista. And Cindy Sim.
Hello, thank you, Helen. Yeah, my name is Cindy Sim. I am the CEO of Team CarePal, and we advocate for the family caregivers to help them care for their loved one with all the tools and connecting them to resources and organizations to help them prevent burnout.
Great, thank you, Cindy. Blair, I have you next in my list here.
Hi everyone, my name is Blair Wold. I'm a practice lead with AHS. I'm new to this team, so I'll be working with the Connecting People and Community for Living Well project for the next 3-year grant. And so you'll probably see me in the future facilitating one of these meetings, but it is nice to meet everyone on the call.
Great, thank you. And Glenda Tarnowski.
Hi, good morning, Helen and everyone. Glad to be here. My name is Glenda Tarnowski, and I work with the Caregiver-Centered Care Education Team at the University of Alberta, Department of Family Medicine.
Thank you. Kate, I have you next on our list here.
Hi, everybody. I've met a lot of you. You've probably received emails from me. I'm Kate Huang. I'm the project coordinator for the Connecting People and Community for Living Well team. I'm based in Calgary here.
Okay, and let me. Okay, sorry, I'm just trying to move my list there. Sharon Cornelius.
Hi, Sharon Cornelius from the Town of Stony Plain Community and Social Development, and working on the Westview Dementia Collaborative Project.
Thank you. Then I have Moo Lavin.
Oh, sorry, you're on mute still, Moo.
There we go. Sorry about that. My name is Moo Lavin, and I am a caregiver of an 82-year-old Alzheimer's chap at home.
Thank you. And Erin McFarlane.
Hi, everyone. I work with, so I'm Erin, as was just said, I work with Healthy Aging Alberta and the Healthy Aging Alberta core platform. So happy to be here today.
Great, thanks, Erin. Shauna McGann.
Good morning. I'm with the Health System Integration Team. It's a provincial portfolio within AHS, really helping to bring people together and support people in being well at home and all those connections that need to happen for that.
Thanks, Shauna. Alexandra, I have you next on my list here.
Good morning, I'm Alexandra Timchuk. I'm the new research coordinator for the Connecting People and Community for Living Well team, and I'm also based out of Edmonton.
Thanks. And Liz Denier.
Good morning. I am with the Calgary Foothills Primary Care Network. I'm a program manager with our projects and partners portfolio.
Great, thanks, Liz. And Kathleen Malley.
Hello there, I'm Kathleen and I am joining from Health Canada today.
Great, thanks, Kathleen. And Deanna Cretu. Or Diana, sorry.
No, that's actually, I was going to say, I acknowledge my name is spelled like Diana, but I pronounce it Diana to honor my Romanian heritage. So you're right on my name. I use she, her pronouns, and I am zooming in from Amiskwaci, Waskahikan, which is Treaty 6 territory here in Edmonton, Alberta. I have the honor and privilege of being the community engagement coordinator for Imagine Institute for Learning, which is a capacity building and training institute. And my role is the coordination of free mental health first aid supporting older adults training across the province. We have funding to do this work until March 2025. So I'm trying really hard to spread the good word and let as many folks know that this training is available for free. So if you'd like to connect, always happy to connect with you.
Thank you so much. And Stephanie Catudel.
Hello, everyone. I'm Stephanie and I work for Alberta Health Services in the Central Zone. Today, I'm coming in from Innisfail, covering provide support to Red Deer County and Olds and Sundre, and I'm looking forward to hearing what's new with the team this morning.
Thanks. And Drew Finson.
Hello, I'm a recreation therapist for the North Zone specialty teams, and I work out of Grand Prairie, and that's an AHS department.
Great, thank you. And Sylvia Castro.
Good morning, everyone. My name is Sylvia, and I'm the provincial coordinator for the Friendly Calls program for the Canadian Red Cross, and happy to be here. Thank you.
Thanks. And Vivian Nguyen.
Hello, everyone. I'm Vivian Nguyen. I'm a consultant at the Vulnerable Populations Department in Edmonton Zone, Alberta Health Services. I'm actually here in lieu of my manager, Jacob Van Nessel.
Okay, thanks, Vivian. And Abram Gucher.
Good morning, everyone. Abram Gucher. I'm with the Provincial Senior Health and Continuing Care program with Alberta Health Services.
Thanks. And Fiona.
Hi, I'm Fiona. I'm with Alberta Health Services. I'm with the Provincial Senior Health and Continuing Care.
Great, thanks. And Nicola McFarlane.
Hi there, Nicola McFarlane with the Innovation Business Intelligence Group with AHS. I work with Abram Gucher on a program for older adults and technology development, implementation, and feasibility.
Great, thank you. And then I have a phone number here, and 877-748-1. Wondering who's on there.
Not sure if that's me. Can you hear me?
Yes, yeah.
Okay. Yeah, I'm on the phone here. It's Darren from Barhead Family Community Support Services. I'm the Community Development Volunteer Coordinator here.
Great, thank you, Darren. Great. And then I think the rest that are left are back to our team. So I'll go over to you, Katie.
Yes, hi, good morning, everyone. My name's Katie Mellon, and I'm one of the provincial practice leads supporting the Connecting People and Community for Living Well Health Canada grant.
Thanks. And Sharon.
Hi, good morning, everyone. Sharon Hamlin, Senior Practice Consultant supporting this Health Canada grant work. It's great. We're excited for this season. Thank you all for joining.
That's for sure. And thanks everyone for doing that introduction. Often the group is too big to do that, but it's kind of nice to have that real connection as we're getting started in our season there. Okay, I'm just going to move. Oops, that went over. There we go. Hand it over to you, Kate. You were going to talk a little bit about our partners meetings here.
Yeah, I'll keep this really brief. A lot of you, because you're here, you're probably aware. Our partners meetings, we hold them from September to June. It's usually on the fourth Tuesday of every month from 9:30 to 10:30 a.m. This month was a special exception. We had an all-day meeting yesterday that it had to be scheduled around. December will also be different because there's not a lot of people who want to come talk with us on Boxing Day. But yeah, these meetings are open to everyone. They're really open to anyone involved in or interested in community-led work to support seniors and other underserved populations in the community. So that includes, people from the health, social sectors, caregivers, people with lived experience. Really, everyone is welcome to come to these meetings. And please do feel free to share the invitation with your networks. You're all here, so you know that you have to register to get in, and that's really just how we kind of manage our list and make sure that everybody gets the emails. You only have to register once for the series, and then just feel free to attend the meetings as your interest and as your schedule permits. Don't hesitate to contact me for any help with registration, information, anything related to these meetings. And as you know, these sessions are recorded and they're available for you to watch if you miss the meeting and you want to catch up. They're all on the Healthy Aging Alberta YouTube channel. Our playlist will be linked, and I'll send a follow-up email after all of the meetings, so you'll get the link to those recordings. And thanks. Back to you, Helen.
Great, thank you. So I think what I'm going to do now is actually just stop sharing my screen so that we can have a real conversation about how things are going in your organizations and communities, and just to hear from each other, about what is happening and what the plans are for the fall is what we were really excited about hearing. It's been a smoky summer, but a warm one also. And so just anybody who would like to start to let us know what are some of the priorities and maybe some of the challenges that you're seeing right now in your work and in your communities. Hi, Sharon. Thanks for being the first one there.
Well, I work with the town of Stony, or the tri-community area, for the Dementia Friendly Project. And I'm very excited because our Trail Explorers program, which was a program for the individuals living with dementia and their care partner to go on a tour around a certain path with a trained volunteer, that was a success this year. And I am so thrilled because last year it just didn't run. So we're very excited for this, and the connections that have been made in between the care partners during the walks has been amazing. But one of the learnings that I have from that, and I knew it before, but I said it just comes back again, is you have to be flexible in anything that you're doing with individuals in all walks of life, right? So one of our key persons, I think, is going to be bowing out because of our partner having to be placed. So we're just having to work through that. But I'm still excited that we had that. And then we also had a horse and buggy mural tour around the town of Stony Plain. And that was very successful for both the individuals living with dementia and their care partners. So I'm excited for the fall. Lots of stuff happening, and we're just finishing off our Connecting Through Art today.
Oh, nice. Great.
Lots happening.
Yeah. Super. Thank you. Anybody else want to build on that excitement that's happening there in Stony Plain? And really wanting to hear from organizations too around, and the people who are here from Alberta Health or Alberta Health Services about some of the work that is happening. Hi, Glenda. I see your hand there.
Hi, I'll jump in just to give you an update of what's happening with the caregiver-centered care education for the health workforce team at the University of Alberta. We had a busy summer, and we are thrilled to now have the advanced level education completely released online, available for individuals to take free of charge. So that's really exciting. And we are ramping up and working on the champion level education. Also, in late fall, we will be bringing together a physician education advisory group that will help to inform the content for physician-specific education for better engaging, partnering, and supporting of family caregivers. So it's really been an exciting time for us, and we've got many presentations in the fall as well. So we're really seeing a boost and increase in scale and spread of the work. So we're excited about that, and also excited to be partnered with Alberta Health Services on some initiatives as well. So it's all great work. And thank you
Yes.
all for the work that you do with family caregivers and supporting and spreading the word about this education within the context of your own practice. Thank you.
Great. Thanks, Glenda. That's super. Yeah, I was having a look at that education the other day. So I'm working my way through the different domains there for the advanced education. Yeah.
We a spoiler alert, I guess we're looking to have some partner meeting sessions dedicated to carers, Glenda. So we'll be meeting with Jasneet and Sharon next week, I think, or maybe it's this week, I can't remember, to do some brainstorming about that. But I'm sure that will involve you at some point. But yeah, I mean, it's carers of all sorts that your work supports, and yeah, really be great to have the opportunity for folks in this environment then to learn about that too. So thanks for that update. More to come for the rest of you on the line for sure.
And thank you as well.
Yeah.
Thanks, Shauna.
Hi, Cindy. I see you there.
Yeah, I kind of want to, bounce off what Glenda was saying too. Team CarePal is going to be adding a link in our dashboard for health organizations that includes the wonderful caregiver-centered care advanced education modules that are designed for healthcare providers, designed, to help them with direct contact with family caregivers and recognizing them as part of the care plan. So we're super excited about that. We have launched in June, so the summer was really busy for us. One of the pain points with family caregivers, though, that we find is that they don't identify as caregivers, which is, so the terminology really, we had to really adapt our terminology to really get the help that they were needing. So there was a lot of learning in that, and I get, why they don't, but, I'm hoping we can change the needle on that a little bit. One of the things, that we did launch is this free caregiver resources poster, and it's really a 5-question poster that we're putting up, at pharmacies and just kind of all around where caregivers, spend a lot of time. Not only educating them that they are in fact a caregiver when they're looking after a family member, but we ask them just some 5, main questions of if they need help with their, role education-wise, if they need, respite, maybe some financial support, maybe, peer-to-peer support or coaching. And then we direct them, based on their responses, we send them an email and we can direct them directly to, Caregivers Alberta, AHS links. I mean, these are all free resources. So we're hoping that'll change the needle, and we can kind of track each QR code at each location to see the traffic of these family caregivers and where they are here in Alberta and kind of what they're looking for. So that's kind of a pilot we're doing over the next year, just to kind of get that help out to them and educate them further. So yeah, if anybody has any questions on that, we'd love to talk to you about it.
Great. Thanks, Cindy. And Krista, I see your hand there.
Hi, yeah, good morning. So here at the Edmonton Seniors Coordinating Council, in July, we launched the new coordinated outreach model here across the city of Edmonton, which involves 12 different organizations to connect seniors to services across the city of Edmonton. We also have the social prescribing program, which is up and running, that works with healthcare professionals to identify when an older adult has a non-medical need that they're seeing in a health setting, and accessing supports to help that person to age well in community. So the social prescribing program is going well. Referrals are coming in quite steadily, and we're very excited about that. We also have our Age-Friendly Edmonton lunch and learns that have returned. So if anyone's interested in that, I'll throw some links in the chat just for more information.
Great. That's super. Thanks. Thanks, Krista. Yeah, we could add those to our, after the partners meetings, we send out a follow-up email, and we could add those links also to there. So if our team can grab those links, that would be great to do that. Yeah. Anybody else?
Helen, I'm just seeing a message from Liz with the Foothills PCN.
Oh, yes. Yeah, thanks.
Hi, I don't know why I can't raise my hand in Zoom, but here we are. We right now are just working still on our case collaborative model. And so what we do with that is we have tables for our older adults at risk in Cochrane and in Calgary. And we bring together our community partners, our AHS partners, our primary care partners, police, and we all work together at the same table with the patient and their family to try and mitigate risk and help put plans in place to support some of our more complex older adults. And I think the challenges we're seeing just right now are just struggles within the healthcare system for burnout with frontline teams, lots of turnover in frontline teams, and trying to get some continuity of care for our clients and our patients. But it's busy, which is nice, and it's a great way to bring partners together. So
Nice. That's great. Thank you. I think we'll be wanting to hear more about that. Thank you, Liz, for letting us know about that. Anybody else that? I was just wondering if anybody else is finding that in terms of that. Oh, I've got a couple of hands up, so I'll go there first with it. Deanna Cretu, I see your hand there, and then we'll go to Nicola.
Okay, sounds good. I wanted to briefly share, I know based on the conversations I've had so far with folks within the senior sector, a lot of individuals don't really know what Imagine does. So I just wanted to quickly share that we do capacity building. I would say trauma-informed care is kind of the bedrock of our training. So it's the spirit in which we move forward in all of the training that we do, but we do have some training around psychological safety in the workplace, sort of unconscious bias as well. We have just released our training framework inventory that provides a little bit more of a thorough understanding of all of the different spaces in which we can provide capacity building support. And I wanted to then focus and zoom in a little bit on the mental health first aid training. We have received funding to do this for 3 years, as I mentioned, and we got started last summer. The demand has been very high for the training. Of course, not having a cost definitely removes a barrier. I was going to say that we are still looking to book sessions with organizations sort of for the remainder of the fall as well as in the new year. So if anyone would be interested, I added a little link in the chat box just here to our website where you can find a little bit more about what we do in general, as well as the mental health first aid training. And then we do just acknowledging that sometimes capacity is tough, and getting lots of staff in a room together is sometimes really difficult. I wanted to also mention that we do have an individual wait list that folks can register for, so that they receive updates of any upcoming sessions, and that way they're able to kind of take the training at their own pace in their own time.
Great.
But yeah, I'm always happy to connect.
Thanks for sharing the links there. That's great. Thanks, Deanna.
Diana, or Deanna, I apologize. Can you just say the name of your organization again?
Imagine Institute for Learning. I'll
Imagine Institute
the
for
chat box
Okay.
to the website as well. But
Great. Thank you.
Great.
Yeah, we'll gather up the links that have been shared in this meeting and send them out with the recording afterwards as well. Yeah. So that's great. Thank you.
Super. So I think I had Nicola next, and then over to you, Mew, after Nicola.
Sure. Thank you so much. I'll just be quick here, as it's just kind of an announcement, and we'll have more information as it comes. And I'm hoping to maybe get a core meeting group set up in future. So as I mentioned, Abram Gucher and I are working together on a new program that we've been added as part of the lead of Alberta Beachhead for Envisage. Beachhead is really just another word for evaluation group. So we're tasked with connecting with end users, and we're looking in the home care space, both within AHS and throughout Alberta, to test innovations specific for older adults, or that help them, whether it be with caregivers or providers in the aging in place and service providers areas. And so you'll hear more about this. There'll be a call out for innovations in I'm thinking early 2024. We're just in the process of setting up the beachhead, looking to see what the needs are by those end users. And so I'll put in the chat a form that we're putting out for anyone who'd like to engage with us further, like to learn more. I believe the link for Envisage is on that form, so you can look a little bit further. So you might hear more later.
Super. Nicola, I'll encourage you to connect with Cindy, as well as from, I think it's Katrina Sylvia from, or Sylvia, sorry, from the Friendly Phone program also, through
Yes.
Red Cross. So there's
Okay.
lots of people on the line here. I think some great connections to make there. With
Awesome.
it.
Thank you so much for that.
Yeah. So Mew, you've been very patient waiting
Oh.
for us.
Middle name these days. I need your advice, all of
Okay.
you, whoever.
Yeah.
Some of you already know that I want to change the self-managed care to the invoicing program for all of Alberta for healthcare support in the home. I am not sure how to go about it. Do I approach the ministry to get a major change? Do I approach Northern Zone? Do I approach AHS? And whom in AHS would be the right person to speak to? It's a behemoth of an organization. So there are a lot of little worker bees in there, and I have no idea who the queen or king bee is.
Yeah.
So that's what I need to do. I want to go forward with this now. I am very privileged that my husband is the only person in Alberta outside of Edmonton that has the invoicing program, and that is official. Now, they did say in May that they were going to discuss it and start moving forward with changing it over in the summer. I have not heard a word, and nobody that I speak to knows anything about it. So what do you think my game plan should be, ladies?
Thanks. Yeah. Mew, can I just ask who you were talking to before about it? Because maybe some of our colleagues on the line are able to know who, have connections with that person.
I've been talking to the service coordinator in AHS, the patient service person. But she's closed my file because I've got what she needed me to do.
Right.
And I found out all this information from her. Then I was on with the caregivers group, and they had a speaker from the health advocates.
Oh, okay. Yeah.
They have said, well, they will see, they seem to think my best route is straight to the ministry. I really don't want to upset anyone. And if things are in motion, then that's good.
Yeah.
I'd like to have some input, of course.
Yeah.
One always does. But thank you.
You bet. No, I love that. Thank you, Mew, because it's really, we're all trying to work in a collaborative type of way, but to have that input right from the start, so that really is meeting the need of what's out there. Don't know if there's anybody from the folks who are here from either Alberta Health Services, the provincial team, or from Alberta Health that are feeling about that they could speak to that or suggest who to get in contact with, that Mew could continue this work that she's anxious to do.
It's Abram here.
Hi, Abram.
I wonder if patient relations might be an avenue. I think typically we think about complaints going to patient relations, and I don't think that this is a complaint. It's more of feedback or recommendation. But I think that that might still be appropriate, because then it would get escalated both to likely the zone program area that's supporting you, which sounds like it might be the North Zone, but also likely to the relevant leadership within our provincial team. And I can maybe give those people a heads up that it's might be coming as well. But I wonder, just to get it formally through that intake mechanism, then for sure you'll get a response. And I can put that. Oh, sorry. Go ahead, Mew.
No, I just said I appreciate that.
I'll drop that link into the chat for you, and then yeah, I'll let a few people know on our provincial team as well.
That's great. And Mew, I mean, we have your email address through this, Abram. If there's somebody who would like to reach out to Mew through us, is that okay, Mew, for us to share?
Absolutely. I did get, after the meeting in January or February, I did get a couple of emails, and I have just been so busy moving back from the seniors residence to the house.
Yeah.
And my husband he's in cognitive free fall. So
right.
It's an adjustment every single day.
Yeah. No, for sure. That's great. And I don't know if there's any ideas from people on the line around is there use in connecting with Alberta Health around this or not, or best to kind of work through Alberta Health Services and then they have their connections with Alberta Health. Just wondering if anybody has an idea about that. That's okay if you don't. Just thought if we had the opportunity, great. I mean, I do think, Mew, and I really appreciate you bringing this here, because I think it's one of the things that we're hoping is that we can start to have some of these conversations across different sectors and caregivers and people. And so if we can start some of that connecting through this forum, then that's great with it. So thank you for bringing that forward. Yeah.
Very welcome. It's just that I feel so privileged. I'm in the northern zone. I'm in a little tiny divot in the northern zone.
Yeah.
And I feel very privileged that they're allowing me to stay, or allowing us to stay on the invoicing program.
Yeah.
But when I talk to other people around and about, they are just struggling so much. You just wouldn't believe how much they are struggling with self-managed care, and have given it up because they can't do it.
Yeah.
And it's onerous. It's got worse.
Yeah.
And I just feel that it's my job as a retired RN and home care nurse that it's beholden to me to do something about it.
Keep carrying the torch there. I just see the question from Shauna in the box about she's new to the lingo and not clear what the invoicing program is. I'll give a little synopsis of what I know, and then Mew, if you want to clarify, or anybody else for me. So Shauna, I'm not sure if you're aware of the self-managed care program, which that provides funding to families and individuals to purchase their own care. Now, there's a lot of accounting that goes with that, and you have to do all the hiring and all the checks for those employees and that kind of thing. So kind of I think an evolution of that self-managed care program has been to provide the funding through Mew would contract with a care provider, and then she would send an invoice to Alberta Health Services for that to be paid. And of course, it's all based on the assessment and number of hours that are approved for Mew to seek out for the help with her husband. Is that a fair representation?
Except that the companies just send in their hours.
Oh, okay. Great.
Blue Cross, and Blue Cross are the agency that pay it on behalf of Alberta Healthcare Services.
Great.
And as a caregiver, I do not have to do any of the bureaucracy that is involved with self-managed care, which is onerous. It is terribly onerous, and I'm reasonably bright, shall we say?
I think very, but anyway,
with the computer and putting my view across, but 90% of the population, certainly in our area, are not, and they are not privileged enough to be able to advocate for themselves.
Yeah.
And as I say, self-managed care, if you don't know anything about it, it is horrible. The invoicing program is brilliant. I get a receipt every month from the company to say how many hours they've done, so I can keep a check. And then and they've sent it, and anything else, I have the aid for longer, so I pay some out of my own pocket. But it's a much better system. It came from Saskatchewan, just in case you wondered if they pulled it out full thin air. They didn't.
Yeah.
And Edmonton have been doing it for 2 years now, so it's time that it moved on.
Great. Yes. Yeah, absolutely. Thanks. And Stephanie, I see your hand up there. Thanks for
Oh, just gonna turn my camera on for a second.
Great.
So yeah, my camera's not being very good. So I'm Stephanie. I work like I said, for Central Zone, and I don't see a lot of other people from Central Zone on. So in my world, we've done a whole ton of transitioning and moving around with staff changes and whatever through COVID and after. And so I've just reacquired Sylvan Lake, and they are quite an active community. And one thing that's really exciting for them coming up is they're working with Healthy Aging Alberta and doing an asset map of seniors services and assets in their community. So that's coming up there. And I think I might have other communities. I also have Sundry, who has she's a very active senior who wants to take charge, and hopefully we can do that there as well. Just sort of really, there's been so much focus lately, like when the previous government, there were grants around children's assets and youth assets, and it's really great to see that it's swinging toward the other way, and really looking at what is in the communities to support seniors, and what are the gaps, and how can they be filled. So
great. Thank you, Stephanie. Great. I was just going to let the people who have joined a little bit later, I see 2 or 3 of them there. Just today is a time for us to kind of check in, hear what's happening within organizations, or raise concerns that looking for some support with there. So please join in and let us know what's happening for you in your community or within your organization there. And then in a little bit later on, we'll also then just have a bit of a discussion about what we'd like to see as topics for upcoming partners meetings as we move forward. So anybody else that would like to share that? Is that Jennifer, or you're just on mute there? If you're
Sorry, a little disjointed and very, very late to the game here. So my apologies for that. But I really just wanted to kind of get back connected with everything that's going on with the network. So I'm working in my own realm now as a business owner in the area of brain health and seniors. Still very active in the communities of Okotoks, Black Diamond, Turner Valley, looking at support for Longview, Bragg Creek. So there's a lot of interest in memory cafes, some facilitating 2 cafes, one in Okotoks, one in Diamond Valley, and most likely those other 2 communities that we talked about. So I just wanted to kind of check in with you guys and just share what we're up to. Also still working on the task force for Dementia Network Calgary, and we're looking at providing support for the community of Airdrie with Seniors Fair, and very connected with the FCSS and groups in Okotoks about coordinating a Seniors Fair there as well. So lots and lots of interest in what's happening. We've also worked with the Okotoks Library to create something called memory kits, which are basically kits of resources that library members can take out from the library and work with their caregivers. The caregivers can work with their loved ones with those packages. And leading 2 courses, one called the Memory and Aging Program, which is about people who are just interested in finding out whether it's their own memory, whether they have concerns about dementia or not, and tips and tricks from kind of a psychological background. It was developed by Baycrest Health out of Toronto to just put people's minds at ease that this may be regular forgetting as opposed to dementia, because there's a lot of increased anxiety when people think that they are leaning towards dementia. And then I'm also working very much in the proactive side of things with a course that I've created called Brain Boost, which looks at the diet and lifestyle interventions that we can be doing for ourselves to mitigate the risk of dementia. Also working alongside Caregivers Alberta to offer a program called Caregiver-Centered Care, which goes into facilities to help bring the caregiver, bring light to the caregiver to work alongside the partners in communities to help support residents better, and doing some presentations in a lot of the seniors facilities throughout Calgary and surrounding rural areas. So that's just a brief overview.
Thanks, Jennifer. Sounds like you're busy there for sure. We're just collecting links to anything that people are talking about today. So if you have a link there that you want to share, please put it in the chat there. So
perfect. Thank you.
Yeah, I see Drew, I see your hand up there.
Yes, hello. Sorry, I work for the North Zone specialty teams, which encompasses both the palliative care team as well as the complex care team. So there's kind of two exciting, or there's things happening on both teams, which is nice. We do have the grant for LEAP, which is you know, Canada's gold standard for palliative care through Pallium Care. And so that's being offered for free for the next year and a bit. So there is registration available through like North Zone that is free. There's physicians care, there's non-physician care, just so that they can kind of make the education more relevant to what area you work in. And then also for the complex care team, two things have kind of happened. The geriatric seniors consult team merged with our complex care support team. So we have one kind of complex behavior team working in the North Zone. And then we also have been working with what we're calling a sensory lending cupboard. We had a grant last year that allowed us to purchase a bunch of sensory items that can be given out on loan to long-term care DSL facilities for clients that might be struggling with behaviors, and they're just different types of sensory items. So we have portable bubble tubes and weighted blankets and some of those pets that are interactive. And so that's just a few of the things. We have like a cupboard of over 100 items that can go out on loan for people to try. And yeah, so those are just two things in the North Zone, or a few things in the North Zone that are exciting right now.
Great. Thank you, Drew. And how do people access that, the loaner?
The lending cupboard.
Yeah, the lending cupboard. Thank you.
Well, just a referral needs to be put into a complex care team. And normally we would like that, you know, nursing staff is aware that the referral is being put in, as a lot of the time allied health staff are the ones that put in the referral, but are only there from 8 to 4. Nursing staff are the ones that are there around the clock. So making sure everybody is kind of aware that it's going in. And then they just put in the referral. And then when it is housed, we have 4 of them housed throughout the North Zone. There's one in Fairview, one in Grand Prairie, one in Edson, and then one in Westlock. And so either a recreation therapist or an occupational therapist holds the cupboard, and whoever is closest will often go to the site or work with site staff to figure out what items need to be trialed. And yeah, just a referral needs to go in, and then we kind of go from there. And that can be through CCA, sorry.
Through CCA, that's what I was.
Yes, sorry.
and is that the 496-1300?
Oh my goodness, I don't know it off the top of my head, but the North Zone CCA has a form. Just a second here, I have it in my. I'm sorry, I don't know the number off the top of my head. But yes, the North Zone CCA form can be found online, and yeah, just through North Zone CCA.
Okay, well maybe we'll try to do a little searching then after the meeting there. Yeah. Good. Well, thank you so much. Anybody else that would like to share? This is so great to hear all the different activities that people are involved in and working on. I think, you know, I think back to 2018 when I started in this work, and this is not a conversation that we were having and hearing about. So it's really quite dramatic, and that's just super to hear for sure. Yeah.
I just want to say what a great eclectic collection of resources that are being shared. You know, I think one of the things that we strive for in this group is to be that networking and information sharing space. You know, oftentimes this is this particular you know, September, as Helen said earlier, is a bit of a let's drop anchor and see how everybody's doing. But you know, I think the networking and information that's being shared is so valuable. So we're taking down tasks of things that we can follow up with as a team. But thank you all for your willingness to share your resources and your roles in the community. It's part of just how we get to know what's happening in the province. So thank you all.
Yes, thanks, Sharon. I'm just seeing a request from Glenda, and so we'll have to do a little bit of thinking. She's asking if we could share contact information for those on the call so that, you know, you could follow up with areas of interest. Oh, and thanks, Drew. I see that you've put the form in there. Yeah. And so I think what we need to do is we need to get some permission to be able to kind of pull together a list like that. And so maybe that's what we can do as we're sending out our follow-up email, is to have people indicate who would be happy to share their contact information there, and then we can pull something together there. So unless somebody else
Thanks,
has
Helen.
another, yeah.
There's just so much rich information. I can't keep everybody straight.
No, it's
Yeah.
true.
So I'm writing
Yes, sir.
furiously on this end. So
Yeah, you bet. And,
wonder if
and any of these websites that have been shared, we will send those out for sure afterwards. So that'll give a number of the contact information there with it. So we'll see what we can
wonder
do
if
to
a
start.
place to start,
Mhm.
Helen, is
Mhm.
for the people who have shared links,
Mhm.
you know, just by show of hands or thumbs up, would you be okay if we attached your contact information to that link in
Okay.
share? Yeah. Okay.
Can we have to leave them just for a minute? Well, Kate, are you getting them down there?
Okay.
We got Drew, Stephanie, Deanna, Nicola,
Nicola,
Cindy,
Deanna, Jennifer.
Aaron,
Awesome.
and Jennifer.
Okay.
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 And
Looks
Liz.
like,
And Liz
yeah,
Denier.
thanks.
Yeah.
Thanks for your willingness to
and
do
Glenda,
that.
yeah.
It's
And
all
Sharon,
those connections.
Helen, I had my hand up as well for, I had a thumbs up and my hand up because I just, we get some interesting resources within our health promotion team. And I'm going to put a link in. There's one on Indigenous and, just a second, I have too many windows open, just a second. It is on feeling welcomed, creating space for Indigenous voices in brain and mental health research. So I'm not sure if it's going to involve sort of our older adult population, but it's put out by the BC Injury Research and Prevention Unit, and it's tomorrow. It's a really short deadline, but I'll put the link, the registration link in the chat, just in case anybody's interested. And we get all sorts of really cool stuff too. And I think I've shared it with Kate before, so
great.
We can, yeah.
Super. That's great. Well, I'm just seeing now that we're at 10:20, and we did want to hear from everyone any ideas that you have around our future partners meetings as we're moving through the year. Sharon had shared that we are going to be doing some planning around meeting, well, maybe more than one for sure, around caregivers, some of the resources, and hearing some of the stories and that kind of thing. So are there other areas that people would like to see highlighted? Yeah. Hi, Drew. I see you came off your.
Sorry, our team. I didn't want to say anything till I got an answer, but our complex care team does work sometimes closely with self-managed care, and I did get some names that I can pass on about self-managed care in the North Zone, if that's possible. Just who the lead is as well as the manager.
Yeah,
Drew,
that would be really.
Do you want to just maybe send me an email with those names and I can pass those on to Mew?
Definitely.
Perfect. Thank you.
You're welcome.
Thanks, Drew. That's great.
Yeah, thank you, Drew. This is what it's about.
Exactly.
Totally what this is about. So thanks, everyone.
But working together as opposed to, fighting, right? How do we build that? Yeah. Yeah, so just back to any ideas that people have in terms of areas that they would like to see covered in our upcoming, and I, one of the things that I'm thinking as we're hearing about all these different resources that we will probably be reaching out to some of you on the call here who we haven't had a chance to have deeper conversations with to see about being able to present it at the partners meeting in that. So now, since you've shared, just so you know, that might be coming your way with it. But yeah, any areas that haven't kind of been covered today that we'd like to see in the partners meetings. Mew, do you have your hand there? Okay. No, that's it. Okay. I thought it was kind of going up like that. That's okay. Yeah.
A fellow talker of hands. I love
That's
that.
right.
Mute.
That's
I'm always swinging my hands around.
That's right. Yeah.
You know, I think we'll also we have some regulars that pop into this meeting, and we'll try to do a consistent job of just providing a little bit of context at the beginning of the meeting about what this space is for. You know, I think we sometimes jump into what we have on our agenda and not really provide that context, but we'll try as a team to be consistent about sharing that context about what the space is for. But I think, as you know, as this work grows, the evolution of the Connecting People and Community for Living Well work has always been because of learnings that we've had in the community. And so I think we'll see this space evolve alongside of that in terms of, you know, that dementia and care focus that was in the early days. We're evolving now in this next 3 years into other underserved populations. So we'll see other types of resources coming through. And I think it's all in an effort really to better support people living in the community across the province. So it's exciting to be at this place where we're starting to hear of different kinds of resources and supports that are available for people, not only healthcare professionals, but also importantly, those social sector partners in the communities as well. So it's super exciting to be at this space.
That's right. Just taking down a little bit of information that's been sent to me. And I was just thinking about our upcoming meetings. Our plan was, I think, for October. It's still in the forming kind of stage of that, but was to share more around kind of our next 3 years of work, but also one of the things that we've gathered is our kind of lessons learned that came about from the last 3 years of work that really look at what did we learn in terms of grant team, provincial support, also what we heard from the communities, and then also what we heard is working with a larger institution as AHS. So what are some of the things from that system institution level that need to change so that work at the community level can happen, as well as what is some of the future planning that needs to happen for it to be sustainable with it. So that's kind of what we were thinking around the next meeting. But if people have another idea, let us know. Shauna, do you want to talk a little bit more about that? You're saying just wondering how much interest there might be regard addressing social needs. Oh, and you put the poverty simulation in there. Right.
Yeah, the poverty simulation, you know, as part of our RIFs work, had such a transformational.
Can you tell us what RIFs is? Sorry, Shauna.
Oh yeah, sorry. RIFs is reducing the impact of financial strain, and it was a partnership with community and primary care networks to help identify those with financial strain and respond and support patients and the community in a way that's supportive, non-biased, but those that were able to participate in the poverty simulation, it was you know, kind of life-changing, because you just sort of get immersed in what is it like to live with that kind of massive tension and kind of just the role of trying to make ends meet, you know, that just sort of takes up your entire space. And just the stress level that, you know, your health needs just sort of fall to the wayside when you're in that kind of situation. So anyway, just, you know, how can we support those social needs?
Right. Oh, darn. Thank you, Shauna. That's great. Well, we've just got 3 minutes left here, so I'm just going to share my screen again just to finish off. We've got a couple of resources to share. And then, of course, there's going to be a great big long list of resources after this meeting coming out with the email. There we go. So we just wanted to draw people's attention to this WHO evidence and gap maps for the UN Decade of Healthy Aging. They have interactive tools that gather together the research that has actually happened around aging, healthy aging. They've got some around community-led activities, and I guess for us, part of it is when we're having these conversations and working with communities, it's that type of information that then gets fed into this global conversation around community-led activities, as well as supporting older adults, all of those types of things. So we found it quite interesting to look at. So just wanted to make you aware of it. And then just an FYI that we were able to put an article into the Brain Exchange newsletter, the fall one. So that's just come out recently there. And again, we always like to share our website information for people who want to access that. And then our Healthy Aging Core group there too. Yeah, so any final questions or comments? And thank you to everybody who shared today. And it's always great to get back together and get started again in our work in the fall here. Right. Okay, well, I hope everybody has a great rest of your week, and we will see you again in October. That's right. Great. Thanks, everyone. Bye-bye.
Thanks, everyone.
Thanks.